It's quite difficult to summarise what is an eating disorder because there are many forms and they're constantly evolving. So when I started in psychiatry, the historical form of eating disorder was anorexia nervosa, which had been described for centuries. And that's the stereotype of an eating disorder, where somebody doesn't eat, is very active, and is very thin and emaciated. But in 1979, Professor Gerald Russell wrote a seminal paper describing a new form. He called it an ominous variant of anorexia nervosa, and that was bulimia nervosa, where the constant control of eating was replaced by loss of control and binges, and then trying to compensate. And more recently, we've had binge eating disorder described as a new illness. And it's very akin to bulimia nervosa, but they don't use such extreme methods to compensate for weight loss. So they tend to fast, or in fact they gain weight and become obese. It's difficult to say how common eating disorders are because of this rapid change in form and prevalence of eating disorders. So anorexia nervosa, the oldest illness, is not that common. It occurs in less than 1% of young females, whereas binge eating disorder is exponentially rising. And so 5 to 10% of the population have it, and there is much less of a disparity between men and women. Well, there's been so much interest in trying to explain why eating disorders should change in prevalence. So people have been looking at what changes in our society may have predisposed to this, because obviously it can't be genes, because our genes don't change so quickly. And so the factors that people have been looking at is the culture of thinness, the size zero culture, but also the ready accessibility of very highly palatable tailored foods. And it's the tension between these two things, the loss of meal structure, these tempting foods, in the context of trying to be thin, that sets up a tension that can lead to an eating disorder. Men do have eating disorders, but the prevalence in men does vary according to the age. So people before puberty, there's about a third of young boys can get an eating disorder. But after puberty, the ratio changes, and it's more females. In binge eating disorder, however, the ratio of men to women is much less separate than the 10-to-1 we get in anorexia nervosa. There are a variety of different signs for the different forms of eating disorder, and often they're very secret, so it can be very confusing for the families. And often the individual themselves doesn't see there's a problem or doesn't want to see there's a problem. So asking directly, have you got an eating disorder, doesn't get an answer. So individuals who are concerned do need to give themselves more knowledge about these disorders so that they're aware of what are the signs, what they should be looking at. And there are excellent websites. The Beat website, the SLAM website has got some ideas about the sort of symptoms that are present. But then once recognising the symptoms, then persuading the individual to go for treatment isn't always easy. What we have done and been very interested in doing is trying to arm carers with the skills and knowledge so that they are able to take these early steps effectively. Well, probably the causes differ for the different sorts of eating disorders. We think that the binge eating disorders, which have only occurred recently in the last half of the last century, seem to be related to cultural factors on top of a genetic and vulnerability. Anorexia nervosa has been there for a lot longer, and we see it more as a combination of again, genes and certain environmental experiences. But it's much less the modern culture of tempting foods and dieting.